Look at the sheer density of Mumbai. With 20 million people navigating daily life, accessing prompt, affordable healthcare becomes a massive logistical and financial hurdle. In the middle of this chaos sits Dr. Rana. He's 70, completely self-taught, and operates a street clinic with absolute, unwavering certainty. A modern hospital relies on thousands of highly specialized, complex chemical compounds to treat a vast array of different diseases. Dr. Chauhan, however, operates with a much narrower inventory. He claims he can cure any human ailment using exactly 3 things: a tube of Voltaren Emul gel, a bowl of salt water, and freshly squeezed onion juice. Without a shred of scientific backing, his clinic remains packed every single day. People swear by his methods. To understand why, we have to look past his charisma and examine the actual biological reality of what he's doing to his patients. His diagnostic matrix is incredibly specific. Burning fevers get raw onion juice aggressively rubbed right onto the chest. Internal organ pain requires deep massages with warm salt water, and any joint issue gets a heavy smear of Voltaren. Applying kitchen staples to systemic disease ignores the internal progression of an infection until the damage becomes irreversible. During a fever, the brain's hypothalamus raises your core temperature to kill invading bacteria. Applying onion juice fails completely because it has 0 fever-reducing properties. Evaporating off the skin, it cannot communicate with the hypothalamus to lower that internal set point. The saltwater massages hit a similar physical limit. A warm topical application might offer a brief, soothing sensation, but it lacks the chemical ability to penetrate deep tissue and heal torn muscle fibers. Any perceived success from these treatments comes down to survivorship bias, the placebo effect, and the body's natural timeline for resolving minor, everyday illnesses on its own. Voltaren Emul gel is the single piece of legitimate, regulated medicine in Dr. Chauhan's toolkit. It is a heavily researched pharmaceutical, miles apart from raw onions and table salt. Clinically, Voltaren is an NSAID, a non-steroidal anti-inflammatory drug. It is formulated strictly for localized, superficial musculoskeletal pain, like a bad sprained wrist or a sore knee. This cross-section shows the reality of his pharmacological misunderstanding. The active molecules in the ointment only absorb into the top millimeter of muscle. They completely fail to reach the deeper organs or the bloodstream below. Utilizing a functional, localized pain cream as a universal cure takes a perfectly safe medicine and turns it into a dangerous tool of false hope. The true threat of alternative medicine is the lost time. The delay of legitimate care is what turns a treatable illness into a fatal one. Imagine a patient trying to treat a severe, persistent fever with these methods, when the underlying cause is actually malaria or dengue. While the patient spends crucial days waiting for the onion juice to work, the underlying pathogen multiplies unchecked, quietly ravaging the body from the inside. These false remedies provide an illusion of active treatment. They silently steal the exact window of time where modern medicine could have easily saved the patient. Eventually, an untreated infection crosses a physiological threshold. It breaches the body's final defenses, escalating into irreversible sepsis or complete organ failure, landing the patient in a critical care ward. Arresting a systemic biological threat requires strict, measurable scientific rigor. A street doctor's reliance on decades of anecdotal life experience cannot outsmart a multiplying virus. False security is the ultimate hazard of the unqualified clinic. When medical advice is scientifically wrong, the cost is measured in human lives.